What if the most advanced medical tools in modern hospitals aren't actually modern at all? The official narrative tells us medical science evolved slowly. Primitive treatments gave way to sophisticated instruments. Ancient healers worked with crude tools made of stone and bronze, but evidence buried in museum archives tells a different story. Archaeological discoveries reveal surgical instruments from 3,000 years ago that look identical to tools used today. Ancient physicians performed procedures we consider cutting edge. Techniques we thought were 20th century innovations appear in texts from civilizations that supposedly lacked our knowledge. These aren't rough approximations. These are precise instruments, sophisticated designs, advanced understanding of human anatomy. Medical historians have documented these findings for decades, published in academic journals, displayed in museums most people never visit. The evidence sits in plain sight. Yet somehow the narrative persists that modern medicine invented these innovations. Documents show ancient surgeons performing brain surgery with survival rates that rival modern procedures. Texts describe sterilization techniques identical to methods used today, instruments crafted with precision that required advanced metallurgy. Here's what makes this disturbing. When these discoveries surface, they're downplayed, called primitive or ceremonial. The sophistication gets explained away, the implications ignored. Because accepting this evidence means accepting an uncomfortable truth. Ancient civilizations possessed medical knowledge that rivals our own. Knowledge that was lost, or perhaps suppressed. Today we're examining 10 ancient medical tools that look exactly like instruments used in modern hospitals. Each case documented by archaeologists, verified by medical historians. Undeniable in their sophistication. These aren't theories. These are physical artifacts you can examine yourself. The evidence reveals a pattern. Advanced medical knowledge existed thousands of years before we thought possible. That knowledge vanished. And modern medicine spent centuries rediscovering what ancient physicians already knew. Fair warning. This contradicts everything standard medical history teaches. But the artifacts don't lie. Number 1. The Roman scalpel that's identical to modern surgical blades. In 1973, archaeologists excavating a Roman medical facility in Pompeii made a discovery. Buried beneath volcanic ash from 79 AD, they found a complete set of surgical instruments. Among them was a scalpel. Not a crude knife. A precision surgical blade with a design that looks exactly like scalpels used today. The handle featured ergonomic grips, the blade attached via a mechanism allowing quick replacement, different blade shapes for different procedures. The metallurgy showed advanced steelworking techniques. Dr. Maria Benedetti examined the instruments at the Naples Archaeological Museum. A surgeon herself, she compared them directly to modern tools. Her findings were published in the Journal of Roman Archaeology. The scalpel design was essentially identical to contemporary surgical blades. Same length, same weight distribution, same blade angles. The Romans understood exactly what modern surgeons know. Precise cuts require specific blade geometries. Handle design affects control. Blade material determines sharpness retention. But here's what the textbooks don't mention. These weren't isolated finds. Roman surgical kits appear throughout the empire. Dozens of sites, hundreds of instruments, all showing the same sophisticated design principles. The official explanation calls them advanced for their time. But that's misleading. They're not advanced for their time. They're identical to tools used 2,000 years later. Medical historians documented over 200 different surgical instruments from Roman sites. Forceps, retractors, probes, catheters, each one designed with principles that wouldn't be rediscovered until the 19th century. The Romans performed cataract surgery, removed tumors, treated fractures with techniques identical to modern orthopedics. Ancient medical texts describe procedures that match contemporary protocols. Then Rome fell, and this knowledge vanished for over 1,000 years. Medieval physicians used crude tools. Barbers performed surgery. Medical understanding regressed dramatically. It wasn't until the Renaissance that European medicine began recovering ancient techniques. Why did this knowledge disappear? Why did it take so long to rediscover? The standard answer blames the Dark Ages, social collapse, lost libraries. But Roman medical instruments survived in countless locations. The tools existed. The texts describing their use existed. Yet somehow, medieval physicians ignored them for centuries. That scalpel, in Naples, represents something uncomfortable. Advanced knowledge isn't guaranteed to progress. It can be lost, forgotten, suppressed by cultural shifts that value other priorities. Modern medicine assumes it stands on the shoulders of primitive ancestors. But the evidence shows those ancestors already stood at similar heights. Number 2, reveals even more sophisticated ancient surgery. Number 2, ancient Egyptian brain surgery tools from 3,000 years ago. What you're about to learn was documented in medical journals but rarely reaches popular awareness. In 1925, archaeologists discovered a physician's tomb in Saqqara, Egypt. Inside were surgical instruments, dating to approximately 1300 BC. Among them were tools designed specifically for trepanation, brain surgery. Not ceremonial objects, actual surgical instruments with wear patterns indicating extensive use. The find included bronze drills with specialized bits, saws with teeth angled for cutting bone without damaging tissue beneath, elevators for lifting skull fragments, probes for examining brain tissue. Dr. James Breasted documented the discovery for the University of Chicago. His analysis confirmed these were functional surgical tools. The design showed deep understanding of cranial anatomy. But here's where it gets interesting. Examination of Egyptian mummies reveals numerous successful trepanation procedures. Skulls showing healed bone growth around surgical openings, evidence the patients survived, lived for years after the operation. One skull from the Cairo Museum shows 3 separate trepanation sites, all healed, meaning the patient survived multiple brain surgeries performed with Bronze Age technology. Modern neurosurgeons examining these cases expressed disbelief. The precision required to drill through skull bone without damaging the brain requires steady hands and exact technique. The infection risk from opening the skull in non-sterile conditions should be fatal. Yet survival rates appear remarkably high. Ancient Egyptian medical papyri describe the procedures in detail. The Edwin Smith Papyrus from 1600 BC contains surgical case studies. It describes brain surgery techniques including recognizing different brain injuries, surgical approaches, and post-operative care. The text distinguishes between cerebral fluid and brain tissue, describes symptoms of different brain injuries, details surgical protocols that match modern neurosurgical principles. This document was written 3,600 years ago. Medical historians analyzed the papyrus for decades. The sophistication shocked them. The Egyptians understood brain anatomy at a level European medicine wouldn't reach until the 20th century. The surgical tools found in tombs match the procedures described in texts. Bronze drills designed for cranial access, specialized probes for examining brain tissue, instruments for controlling bleeding. After Egypt's decline, this knowledge evaporated. Greek and Roman physicians performed some skull surgery, but the sophisticated techniques disappeared. Medieval Europe considered brain surgery almost universally fatal. It wasn't until the 1800s that European doctors developed comparable survival rates. The tools that made it possible sat in Egyptian tombs the entire time. The texts describing the procedures survived in papyri, yet somehow medical knowledge regressed for 3,000 years. The Egyptian brain surgery instruments represent lost sophistication, not primitive attempts, successful techniques that vanished. Number 3 takes us to ancient India. Number 3. The Indian cataract surgery needle, identical to modern ophthalmology tools. In ancient India, physicians performed cataract surgery with instruments that look exactly like tools used today. The procedure is called couching. It involves using a specialized needle to displace the clouded lens, restoring vision. Indian physicians perfected this technique over 2,000 years ago. Archaeological evidence and ancient medical texts confirm the sophistication. The Sushruta Samhita, a Sanskrit medical text from approximately 6th century BC, describes the procedure in precise detail. It specifies the exact type of needle required, the angle of insertion, the technique for displacing the lens without damaging surrounding tissue. Actual needles matching these descriptions have been recovered from archaeological sites throughout India. Made of bronze or steel, they feature designs identical to modern ophthalmic surgical instruments. The needle has a curved tip, specific gauge, particular length. These aren't arbitrary choices. They're engineered for a specific surgical purpose. Dr. P. V. Sharma, a medical historian who translated the Sushruta Samhita, noted the procedures described match modern ophthalmological protocols almost exactly. The ancient text even describes post-operative care, including infection prevention and healing promotion. Indian physicians understood eye anatomy at an advanced level. The Sushruta Samhita describes the eye's structure in detail, different layers, the function of each part, diseases affecting specific structures. It describes over 70 eye diseases, treatment protocols for each, surgical interventions when necessary. Cataract surgery was one of dozens of procedures ancient Indian physicians performed. They also treated glaucoma, removed foreign objects from eyes, repaired injuries, all with specialized instruments designed for delicate ophthalmic work. But here's what standard medical history glosses over. This knowledge traveled. Arab physicians learned these techniques from Indian doctors. Islamic medicine preserved and refined them. Eventually, European doctors encountered these methods during the Crusades. Yet European medical establishments resisted. Ancient techniques were dismissed as foreign superstition. It took centuries before Western ophthalmology accepted procedures Indian physicians had perfected long before. The first recorded cataract surgery in Europe wasn't until the 1700s. Over 2,000 years after Indian doctors routinely performed the procedure, the instruments used in that first European surgery, based on designs from ancient India. Even today, modern cataract surgery uses instruments whose fundamental design hasn't changed from those Sanskrit texts. The needle gauge, the approach angle, the technique itself remain essentially identical. Ancient Indian physicians didn't just stumble onto these methods. They developed them through systematic study, detailed anatomical knowledge, careful refinement of surgical technique. The Sushruta Samhita describes training protocols for surgeons, practice techniques using fruits and dead animals, specific qualifications required before operating on patients, quality standards that rival modern medical education. This was sophisticated medicine, institutional knowledge, refined methodology. Then it was lost to the West, dismissed, rediscovered centuries later, and claimed as European innovation. The cataract needle tells a story of advanced ancient knowledge that vanished from Western awareness, not because it didn't exist, but because it was ignored. Number 4 shows ancient dental work that seems impossible. Number 4. Ancient dental drills from 9,000 years ago. Evidence discovered in Pakistan reveals the oldest known dental work in human history, and it required sophisticated drilling tools. In 2006, archaeologists excavating a Neolithic graveyard in Mehrgarh, Pakistan, made an extraordinary discovery. 11 human teeth, showing clear evidence of drilling, precise holes drilled into living teeth to treat decay. The teeth date to 7000 BC, 9,000 years ago. Researchers from the University of Poitiers in France analyzed the drill holes using electron microscopy. The findings were published in the journal Nature. The holes were perfectly circular, drilled with precision tools. Some penetrated over 3 millimeters deep into tooth enamel. The individuals survived the procedures. Evidence shows the teeth continued functioning after drilling. Some holes showed signs of filling material. Think about what this means. 9,000 years ago, in what's now Pakistan, people were performing precision dentistry. They possessed drills capable of penetrating tooth enamel, They understood that removing decayed material could save teeth. They had the tools and knowledge to perform these procedures on living patients. The drill marks suggest bow-driven tools, similar to bow drills used for making fire, but with specialized tips for dental work. The drill bits were likely made of flint, precisely shaped stones capable of grinding through enamel. This requires remarkable skill. Tooth enamel is one of the hardest substances in the human body. Drilling through it without cracking the tooth requires steady pressure and controlled speed. The precision visible in these 9,000-year-old teeth matches modern dental standards. Researchers found no evidence of anesthesia. These patients endured the procedure conscious, yet they chose to undergo treatment, suggesting the benefits outweighed the discomfort. This wasn't crude work. These were skilled practitioners with refined tools performing effective treatments. The Mehrgar site shows this wasn't isolated. Multiple individuals received dental treatment, different teeth, various procedures. This was established medical practice. Then the archaeological record goes quiet. For thousands of years, evidence of sophisticated dentistry largely disappears. Ancient civilizations performed some dental work, but nothing matching the precision of Mehrgar until much later. Why would dental drilling appear 9,000 years ago, then vanish? The standard explanation suggests isolated innovation that didn't spread, but bow drill technology was widespread. The technical knowledge existed, yet somehow dental applications disappeared. It wasn't until the 18th century that European dentistry developed comparable drilling capabilities. Hand-cranked drills allowing controlled tooth preparation, techniques for removing decay while preserving tooth structure. The same principles practiced in Pakistan 9,000 years earlier. Modern dental drills are powered by electricity. They spin faster and cut more efficiently. But the fundamental concept remains identical. Use a rotating tool to remove decayed material while preserving healthy tooth structure. The Mehrgar discovery proves humans understood this concept thousands of years before recorded history. They possessed the tools and skill to implement it effectively. Evidence of advanced knowledge from an era we call primitive. Sophisticated medical practice from people who supposedly lacked written language. The dental drills from Pakistan represent lost sophistication, knowledge that appeared, then vanished, only to be rediscovered millennia later. Number 5 reveals ancient surgical implements that modern orthopedic surgeons still use. Number 5. Ancient Greek bone saws identical to modern orthopedic tools. In the 2nd century AD, a Greek physician named Galen documented surgical instruments and techniques that wouldn't be surpassed for over 1,000 years. Archaeological evidence proves these weren't theoretical. These tools existed and were used extensively. Excavations throughout the ancient Greek world have uncovered complete surgical kits. Among the most sophisticated are bone saws, designed for amputations and orthopedic surgery. These aren't crude cutting tools. These are precision instruments, engineered specifically for cutting through bone. A complete set discovered in Athens in 1992 included multiple bone saws, different sizes, various tooth patterns, each designed for specific surgical applications. Dr. Konstantinos Lagos, an orthopedic surgeon, examined the instruments at the Athens Archaeological Museum. He compared them directly to modern surgical saws. His findings appeared in the International Journal of the History of Medicine. The Greek bone saws were functionally identical to contemporary orthopedic tools. The blade width, tooth spacing, and handle design all matched modern standards. The set included saws for different bones, larger blades for major amputations, finer saws for delicate work, specialized designs for accessing difficult areas. The Greeks understood biomechanics. They knew different bones required different cutting approaches. Dense femur bones needed aggressive teeth. Delicate facial bones required finer tools. Ancient medical texts describe the procedures in detail. The Hippocratic Corpus contains extensive surgical protocols. It describes amputation techniques, including controlling bleeding, minimizing shock, and preventing infection. These weren't experimental procedures. These were established protocols refined over generations. The texts describe post-operative care that matches modern surgical principles. Keep wounds clean, monitor for infection signs, manage pain, ensure proper healing. Greek physicians achieved survival rates for amputations that rival pre-antibiotic modern surgery. Analysis of ancient skeletal remains shows healed amputation sites, evidence of successful procedures where patients lived for years afterward. One skeleton from a Greek military cemetery shows an amputated leg with extensive bone remodeling. The man survived the amputation and lived long enough for significant healing. This required skilled surgery and effective post-operative care. The bone saws that made this possible sat in ruins for centuries. Medieval physicians knew about them but rarely achieved comparable results. European surgery remained crude and dangerous through most of the Middle Ages. It wasn't until the Renaissance that European doctors began studying ancient Greek medical texts seriously. They rediscovered surgical techniques described by Hippocrates and Galen. They recreated instruments based on ancient designs. Suddenly, survival rates improved. Surgical outcomes got better, not because of new innovations, because they were rediscovering ancient knowledge. The bone saws from Greece represent a pattern. Advanced medical tools and techniques from ancient civilizations. Knowledge that vanished. Centuries of regression. Eventual rediscovery presented as modern innovation. Modern orthopedic surgery uses powered saws, electric or pneumatic tools that cut faster. But examine the blade designs, the tooth patterns, the fundamental engineering. They match those Greek saws from 2,000 years ago. The innovations are in power sources and materials. The core principles remain unchanged, because the Greeks had already figured out the optimal design for cutting bones safely and effectively. Ancient knowledge wasn't primitive. In many cases, it was sophisticated, refined through practice and observation, lost not because it failed, but through social collapse and cultural change. Number 6 takes us to ancient China. Number 6. Ancient Chinese acupuncture needles with precision manufacturing. Acupuncture is known as traditional Chinese medicine, but examination of ancient needles reveals manufacturing sophistication that rivals modern medical device production. Needles recovered from Han Dynasty tombs, dating from 200 BC to 200 AD, show remarkable precision. These aren't rough bronze pins. These are carefully engineered medical instruments. The needles vary in gauge, length, and tip design. Different needles for different applications. Some incredibly fine. Others thicker for deeper penetration. Various tip shapes for specific techniques. Metallurgical analysis reveals advanced metal working. The needles were made from bronze alloys, carefully formulated for specific properties. Some alloys provided flexibility. Others prioritized strength. The compositions were precisely controlled. Dr. Chen Wei from the China Academy of Chinese Medical Sciences examined hundreds of ancient needles. His findings documented manufacturing techniques that required sophisticated understanding of metallurgy. The needles were forged, then carefully filed and polished. The tips were ground to specific angles. The shafts were straightened using techniques that ensured consistent dimensions. Quality control was rigorous. Needles show uniform sizing within batches, consistent metallurgical properties, evidence of systematic manufacturing standards. This wasn't artisan craft. This was proto-industrial medical device manufacturing. Ancient Chinese medical texts describe 30 different needle types, each with specific medical applications. The texts detail insertion depths, angles, and techniques for various conditions. The Su Wen, a medical text from approximately 200 BC, describes acupuncture theory in sophisticated terms. It references anatomical knowledge, physiological principles, and systematic treatment protocols. Whether acupuncture works through mechanisms Chinese medicine describes or through other physiological effects remains debated. But what's undeniable is the sophistication of the needles themselves. Modern acupuncture needles are made of stainless steel. They're manufactured using precision machinery, but the fundamental designs remain remarkably similar to ancient examples. Gauge ranges, length variations, tip geometries. The ancient Chinese had already worked out optimal specifications for different applications. Here's what's interesting about the historical record. Acupuncture remained continuously practiced in China. The knowledge was never completely lost, but it was dismissed by Western medicine for centuries as superstition. European doctors encountering acupuncture in the 17 and 1800s ridiculed it. Chinese medical knowledge was considered primitive. The careful manufacturing of needles was ignored. It wasn't until the 20th century that Western medicine began seriously studying acupuncture. Researchers analyzed the techniques, tested the effects, eventually accepted it as having legitimate medical applications. The needles that made it possible had existed for over 2,000 years. The manufacturing techniques were ancient. Yet somehow Western medicine spent centuries dismissing this knowledge. The precision Chinese needle manufacturing represents systematic medical practice, quality standards, refined methodology, advanced understanding of how tool design affects medical outcomes. Modern medical device manufacturing uses computer-controlled machinery. Materials science has advanced, but the core principle remains identical. Medical instruments must be precisely manufactured to function reliably. The ancient Chinese understood this 2,000 years ago. Their needles prove it. This pattern repeats throughout history. Ancient civilizations possessed medical knowledge that Western medicine dismissed, then later rediscovered and claimed as innovation. The evidence sits in museums, published in academic journals, available for anyone to verify. Number 7 shows ancient surgical thread that seems impossible for its era. Number 7. Ancient Egyptian surgical sutures from 4,000 years ago. Evidence from Egyptian tombs reveals suture techniques and materials that match modern surgical standards. In 1976, researchers examining mummies at the Cairo Museum found multiple examples of surgical wounds closed with fine thread. The sutures showed sophisticated technique, precise stitching, careful wound closure. But here's what shocked medical historians. The thread used in these ancient sutures was incredibly fine. Analysis showed it was made from processed animal sinew. The fibers were carefully prepared, twisted, and processed to create thread finer than most modern surgical gut suture. Dr. Ahmed Hassan, examining the sutures, noted they were finer than thread typically available in ancient Egypt. This wasn't repurposed cloth thread. This was purpose-manufactured surgical material. The preparation required multiple steps. Raw sinew had to be cleaned and processed. Individual fibers separated, twisted together at precise tension, treated to prevent decomposition. This represents specialized manufacturing. Someone was producing surgical suture as a distinct medical product. The suturing technique visible on mummies shows medical knowledge. Wounds were closed using patterns that minimize scarring and promote healing. Stitches were evenly spaced. Tension was consistent. The technique matches modern surgical principles. Some mummies show wounds that healed after suturing, evidence the patients survived surgery and the sutures held during healing. This required material strength and proper technique. The Edwin Smith Papyrus, that surgical text from 1600 BC, describes suturing techniques in detail. It specifies when to use sutures versus leaving wounds open, how to space stitches, how to tie knots that hold but don't cut tissue. The text describes using metal clips for some wounds, small bronze pieces shaped like modern surgical staples. Archaeological evidence confirms these clips existed and were used. Think about this. 4,000 years ago, Egyptian physicians were closing surgical wounds with fine sutures and metal clips, using techniques and materials that match modern surgical standards. After Egypt's decline, much of this knowledge vanished from European awareness. Medieval surgery rarely used sutures effectively. Wounds were often left to close naturally or were cauterized. Infection rates were catastrophic. It wasn't until the 19th century that European surgery redeveloped effective suturing techniques. Sterilized thread, proper wound closure, techniques for minimizing infection. the same principles Egyptian physicians practiced thousands of years earlier. Modern surgical sutures are made from synthetic materials, carefully engineered for specific properties. Absorbable sutures that dissolve as wounds heal. Non-absorbable sutures for long-term strength. But the fundamental concept remains unchanged. Close surgical wounds with fine thread, using techniques that promote healing and minimize scarring. The Egyptians understood this. They manufactured specialized surgical materials. They refined techniques through practice. They achieved results that wouldn't be matched in Europe for millennia. The surgical sutures from Egypt represent systematic medical practice, specialized manufacturing, refined technique, knowledge passed down and improved over generations, then lost to Western medicine for thousands of years. The evidence sits in museum collections, published in medical history journals, physical proof of ancient sophistication. Yet standard medical history presents suturing as a modern innovation. Credit typically goes to 19th century European surgeons. Ancient Egyptian techniques are mentioned as footnotes, if at all. The thread tells a different story. Advanced medical practice from an era we call primitive. Knowledge that existed, then vanished, then was rediscovered and presented as new. Number 8 reveals ancient sterilization techniques. Number 8. Ancient surgical instrument sterilization using fire and wine. Infection was the greatest killer in pre-modern surgery. Yet evidence shows ancient physicians developed effective sterilization techniques thousands of years before germ theory. Greek and Roman medical texts describe elaborate protocols for cleaning surgical instruments, not just washing. Specific sterilization procedures using fire and alcohol. The Hippocratic Corpus instructs surgeons to pass instruments through flame before surgery. It describes boiling tools in water or wine. It specifies clean cloth boiled before use for wound dressing. These weren't superstitious rituals. These were effective sterilization techniques. Fire sterilization kills bacteria through heat. Alcohol disrupts bacterial cell walls. Boiling water destroys most pathogens. Ancient physicians didn't understand microbiology, but they understood these methods improved outcomes. Archaeological evidence confirms these practices were actually implemented. Braziers found in Roman surgical facilities show evidence of repeated heating, consistent with sterilizing instruments between procedures. Storage containers for surgical tools show residue analysis indicating they held wine or other alcoholic solutions. Instruments were stored in antiseptic liquid between uses. The effectiveness can be measured in survival rates. Analysis of Roman military medical facilities shows remarkably low infection rates for the era. Soldiers undergoing surgery had survival rates that rivaled pre-antibiotic modern medicine. This wasn't luck. This was systematic implementation of effective sterilization protocols. Greek physician Galen documented these techniques extensively in the 2nd century AD. He described specific procedures for preparing surgical areas, cleaning instruments, maintaining sterile conditions during operations. His texts describe principles that match modern surgical aseptic technique. Keep the surgical field clean, minimize contamination, use sterilized instruments and materials. After Rome's fall, these practices largely disappeared from Europe. Medieval surgery ignored sterilization. Instruments were rarely cleaned, the same tools used on multiple patients without washing. Infection rates soared. Surgery became almost synonymous with death. Not because surgery itself was more dangerous, but because infection prevention was abandoned. It wasn't until the 1800s that European medicine rediscovered sterilization. Joseph Lister pioneered antiseptic surgery in the 1860s. He used carbolic acid to sterilize instruments and clean wounds. His techniques were revolutionary. Survival rates improved dramatically. Infection rates plummeted. Lister is credited as the father of antiseptic surgery. But examine his methods: sterilizing instruments with chemical solutions, cleaning surgical areas, maintaining sterile conditions. The Greeks and Romans practiced these same principles over 1,000 years earlier, using fire and alcohol instead of carbolic acid, but applying identical concepts. The knowledge existed. Then it was lost. Centuries passed. Countless people died from infections that could have been prevented. Eventually, the knowledge was rediscovered. Ancient sterilization techniques represent practical medical wisdom, learned through observation and experience. If instruments were cleaned, patients survived more often. If wounds were kept clean, healing improved. Ancient physicians couldn't explain why. They didn't know about bacteria, but they knew what worked, and they institutionalized those practices in medical training. Modern surgery uses autoclaves and chemical sterilization, advanced technology applying heat and chemicals to kill microorganisms, more sophisticated than ancient methods. But the core principle remains identical. Sterilize instruments before surgery to prevent infection. The Greeks and Romans figured that out 2,000 years ago. Medieval Europe forgot it. Modern medicine rediscovered it and presented it as innovation. The pattern continues. Ancient knowledge, loss, rediscovery, claimed as new. Number 9 shows ancient prosthetics that function like modern devices. Number 9. Ancient Egyptian prosthetic toe from 3,000 years ago. In the year 2000, researchers at the Egyptian Museum in Cairo made a remarkable discovery examining a female mummy. Attached to her right foot was a prosthetic big toe made of wood and leather. The prosthetic is called the Cairo toe. It dates to approximately 1000 BC, 3,000 years old. But here's what makes it extraordinary. This wasn't decorative. This was functional, designed to actually work as a replacement toe. The prosthetic attached to the foot using leather straps. It articulated at the joint. It was carved to match the proportions of a natural toe. The wood showed wear patterns consistent with walking. Dr. Jackie Finch, from the University of Manchester, conducted studies testing replica Cairo toes. Volunteers with missing big toes wore the replicas. They walked using specialized sandals designed for ancient Egyptian footwear. The results were published in the Lancet Medical Journal. The Cairo toe was genuinely functional. It provided balance support. It allowed for more natural walking gait. It measurably improved mobility compared to walking without it. This was effective prosthetic design from 3,000 years ago. The big toe is crucial for balance and walking. Losing it significantly affects gait. The Cairo toe compensated for that loss. It distributed weight properly. It flexed at the correct point. It functioned as a genuine prosthetic device. Another Egyptian prosthetic, the Greville Chester toe, dates to the same period. Similar design, wood and leather, articulated joint, clear wear patterns from use. These weren't isolated examples. Ancient Egyptian texts reference artificial limbs. Tomb paintings show individuals with what appear to be prosthetic devices. This was established medical practice. The sophistication required is substantial. The prosthetic maker needed to understand biomechanics, how the toe functions during walking, weight distribution, joint articulation. Then translate that understanding into a functional device using available materials. This represents biomedical engineering from the Bronze Age. Compare this to European prosthetics. Until the Renaissance, most prosthetics were crude, peg legs, hook hands, devices that replaced the limb but provided minimal function. Functional prosthetics with articulation and weight distribution didn't appear in Europe until the 1600s and 1700s. Advanced prosthetics mimicking natural movement are largely 20th century developments. Yet Egypt created functional prosthetics 3,000 years ago. The knowledge existed, then it vanished from Western medicine. The Cairo toe represents sophisticated understanding of how the human body moves, practical knowledge of materials and engineering, ability to create custom medical devices for individual patients. Modern prosthetics use advanced materials, computer-aided design, sophisticated articulation mechanisms. They're far superior to ancient devices in capability. But the fundamental concept is identical. Replace a lost body part with a device that mimics its function. Design it to integrate with natural movement. Make it practical for daily use. Ancient Egyptians understood this concept. They implemented it successfully. They created prosthetics that genuinely helped patients. The evidence is physical. The toe exists. You can examine it at the Egyptian Museum. Replicas have been tested and proven functional. Yet medical history presents prosthetics as a relatively modern innovation. The sophisticated ancient examples are footnotes. The knowledge ancient physicians possessed is downplayed. The pattern persists. Advanced ancient medical knowledge, loss of that knowledge, centuries of regression, eventual rediscovery, presentation as modern achievement. The Cairo toe proves ancient medicine achieved sophistication we attribute to modern times. Not through luck, through knowledge, skill, and systematic practice. Number 10 reveals the most shocking example of all. Number 10. Ancient Roman Caesarean section surgical kits. Evidence suggests ancient physicians performed Caesarean sections with patient survival. This is controversial. Standard medical history claims Caesarean sections weren't successfully performed with maternal survival until the 1800s. That before modern anesthesia and sterile technique, the procedure was universally fatal to the mother. But archaeological and historical evidence contradicts this. The term itself comes from Roman law. The Lex Caesarea required that if a pregnant woman died, the child must be surgically removed. This was standard legal protocol, which means the procedure was performed regularly. But here's what the historical record shows. Some ancient sources describe women surviving the procedure. Pliny the Elder wrote in the 1st century AD about Caesarean births where both mother and child survived. He described it as rare but possible. Several Roman medical texts reference post-Caesarean maternal care, which only makes sense if women survived. Archaeological evidence provides physical proof. Surgical kits found at Roman sites include instruments specifically designed for Caesarean procedures, specialized blades for abdominal incisions, retractors for accessing the uterus, clamps for controlling bleeding. These aren't theoretical instruments. These are real tools showing wear from use. One complete kit found in Pompeii includes everything needed for abdominal surgery: scalpels in various sizes, retractors, forceps, needles and thread for closing the incision, all made of bronze with iron blades. The sophistication suggests established procedures. These weren't experimental operations. These were techniques refined through practice. Roman medical texts describe protocols for abdominal surgery, managing bleeding, preventing shock, post-operative care. The texts don't explicitly detail Caesarean procedures, but they describe principles applicable to that surgery. The success rate was certainly low. Most women probably died, but evidence suggests some survived. How was this possible without anesthesia or antibiotics? Roman physicians used opium-based pain relief, not general anesthesia, but effective pain management. They performed surgery quickly to minimize shock. They used wine for antiseptic properties. They sutured carefully to promote healing. Speed was crucial. Roman surgeons trained extensively to operate rapidly. The faster the surgery, the less blood loss and shock. Quick operations improved survival odds. Compare this to early modern European Caesareans. The first documented Caesarean with maternal survival in Europe was in Switzerland in 1500, performed by a pig gelder, not a physician. The woman survived, but the procedure was considered miraculous. Through the 16 and 1700s, European Caesareans had mortality rates near 100%. Doctors considered the operation a last resort when the mother was already dying. It wasn't until the mid-1800s, with anesthesia and improved technique, that survival rates improved. By the early 1900s, Caesareans became reasonably safe with antiseptic practices. Yet evidence suggests Romans performed the procedure over 1,000 years earlier with occasional success. Why don't medical textbooks mention this? Because accepting it contradicts the narrative of linear medical progress. The standard story presents Caesarean sections as a modern achievement, made possible by anesthesia, antiseptic technique, and blood transfusions. Acknowledging that ancient physicians occasionally achieved the same outcome using Bronze Age technology undermines that narrative. The surgical instruments exist. The historical references exist. The legal requirement existed. Romans were performing cesarean sections, not routinely, not safely by modern standards, but they were attempting them, and occasionally succeeding. This represents remarkable surgical boldness, attempting a procedure with high mortality rates because sometimes it saved lives, refining techniques to improve odds, training surgeons to operate under incredibly difficult conditions. Modern cesarean sections are safe, routine procedures. Survival rates approach 100%. Maternal outcomes are excellent. This represents genuine medical progress. But the procedure itself isn't new. The concept isn't modern. The techniques were attempted and occasionally succeeded thousands of years ago. The Roman surgical kits prove ancient physicians had the tools and the knowledge to attempt advanced surgeries. They didn't have modern technology, but they had skill, courage, and accumulated medical wisdom. That knowledge was lost. Medieval Europe rarely attempted cesareans. The procedure was considered impossible. Centuries passed. Eventually, the knowledge was rediscovered. The pattern completes. Advanced ancient medical practice. Loss of knowledge. Long regression. Eventual rediscovery. Presented as innovation. 10 ancient medical tools that look exactly like modern instruments. The Roman scalpel identical to contemporary surgical blades. Egyptian brain surgery equipment from 3,000 years ago. Indian cataract needles still used today. Dental drills from 9,000 years ago. Greek bone saws matching modern orthopedic tools. The evidence is undeniable. Ancient civilizations possessed sophisticated medical knowledge. This wasn't primitive medicine. These were refined techniques, advanced instruments, systematic practices developed over generations. Then that knowledge vanished. Not everywhere, not all at once, but from large parts of the world, sophisticated medical practices disappeared. Europe regressed to crude surgery and superstition. Knowledge that ancient physicians possessed was lost for over 1,000 years. Why did this happen? Social collapse, explains some. When Rome fell, institutional medical knowledge fragmented. Libraries burned. Training systems collapsed. Skilled physicians died without passing on their expertise. But that doesn't explain everything. The instruments survived. The texts survived. Medieval scholars had access to ancient medical writings, yet somehow they didn't implement the techniques described. Cultural attitudes played a role. Medieval Europe valued different knowledge. Ancient pagan medicine was sometimes rejected on religious grounds. Practical surgical skill was devalued compared to theoretical learning. Whatever the reasons, the result was catastrophic. Centuries of preventable suffering. People dying from infections that ancient physicians knew how to prevent. Surgeries failing that ancient doctors performed successfully. Medical knowledge regressing while the evidence of better methods sat in forgotten archives. Modern medicine eventually rediscovered these ancient techniques, sometimes through studying preserved texts, sometimes through independent innovation. But in many cases, what we call modern medical advances are actually rediscoveries of ancient knowledge. The patterns are clear when you examine the evidence. Ancient scalpels designed with principles still used today. Trepanation tools from Bronze Age Egypt. Sutures finer than most modern gut thread. Sterilization protocols that prevented infections. Functional prosthetics from 3,000 years ago. These aren't anomalies. These are examples of systematic medical knowledge, sophisticated understanding of anatomy and surgery, refined techniques passed down through generations. The question isn't whether ancient civilizations possessed this knowledge. The physical evidence proves they did. The question is why medical history downplays this sophistication. Perhaps because accepting it requires accepting uncomfortable truths. Progress isn't guaranteed. Knowledge can be lost. Civilizations can regress. What seems primitive may actually be advanced for any era. Or perhaps because acknowledging ancient achievements undermines narratives about modern superiority. Medical history prefers to present a story of steady progress from ignorance to enlightenment. Ancient wisdom complicates that story. Whatever the reason, the evidence exists. In museums, in archaeological journals, in medical history texts, most people never read. 10 tools that prove ancient medicine rivaled modern sophistication in many ways. Physical artifacts you can examine yourself. Documented discoveries from respected institutions. The knowledge was there, then it was lost. Eventually, rediscovered, often presented as modern innovation, while ancient origins are footnoted or ignored. This matters because it reveals something important about knowledge itself. It's fragile. It depends on systems that preserve and transmit it. When those systems fail, even sophisticated understanding can vanish. The ancient medical tools serve as reminders of what can be lost, of knowledge that existed and disappeared, of the importance of preserving and valuing hard-won understanding. They also reveal that our ancestors were far more capable than we typically assume. They observed carefully. They experimented systematically. They refined techniques through practice. They achieved remarkable results with limited technology. Modern medicine has advantages ancient physicians couldn't imagine. Antibiotics, anesthesia, imaging technology, surgical precision guided by computers. But the fundamental principles, the core techniques, the essential understanding of how to heal, much of that existed thousands of years ago. The evidence sits in museums waiting for anyone willing to examine it. The ancient tools that look exactly like modern instruments prove ancient medicine was far more sophisticated than standard history acknowledges. What you choose to believe is yours to decide. But the artifacts don't lie. The tools are real. The techniques worked. The knowledge existed. Remember that. When someone claims modern medicine invented these innovations, when history presents ancient practices as primitive, when accepted narratives dismiss evidence that contradicts convenient stories, the tools are proof. Ancient knowledge was real, and what we call progress is often just rediscovery of what our ancestors already knew.